Yes.
Dr. Kahura Mundia is the president of the Kenya Dental Association and is our guest. Daktari, good morning.
Good morning.
Karibu sana.
Asante sana.
You're also the deputy national chairman of KMPDU.
Yes, I am.
Viva. Jano, welcome, Doctor.
The quote today is by a Kenyan academic, a translator, a justice advocate, a cultural justice advocate. She's really known for her work around decolonization, African languages. She's called Wangui Wagoro. And her quote is, "Culture is who we become when no one is watching." Culture is who we become when no one is watching. There's been varied interpretations all day. What's yours?
Well, culture is who we become when no one is watching. I'd say culture is a function of a habit. Those things that we constantly do all the time. And we keep doing them. And many other people see us doing the same. And we get to adopt that as a way of doing things. And eventually it mutates into a tradition, and then becomes a culture. It becomes a way of life. It gets to be like a norm of how we do things. So you pick up ways that we probably don't prefer. Those becomes our standards. And so it becomes.
Yeah, and that can inform decades of prosperity or going backwards.
Yes.
That's
So
good.
that affects how whatever we derive from, because you're driven by whatever we get as far as the directions.
That's good.
Our guests are doing a much better job of interpreting this quote than last
No,
time.
you guys did good. No, you did good.
We went sweet.
Everyone's interpretation is valid. Kappa, we validate.
I refuse to interpret that.
Okay, let's.
I have the problem with that being culture.
Culture.
The culture being what you do when no one is watching. That's why my problem.
What shall we beef
That's why
at
my
9?
problem
What shall we
is.
beef at 9?
No. I'm just saying.
Well, maybe they use the wrong word, culture.
Yeah, he said integrity.
Yeah, he said-
Tradition and a norm.
Higher. Sorry.
He's still, yes.
So, we'll unpack the last hour.
Let's just move on. Yeah? When you are a dentist,
Yes, I'm a dentist by first degree.
what is that degree?
Well, the degree is known as the Bachelor of Dental Surgery. And it is what gives you the competency to practice dentistry.
How many years do you study?
This is a 5-year degree program with a 1-year internship requirement. And after that, you qualify now, get licensure to practice as a dental practitioner or as a dentist.
This is different from the other doctor.
This is different now from the Bachelor of Medicine and Surgery because it's a different field of practice. So it's
study
an
to men.
international standard of what you're supposed to be as a dental practitioner.
You study just men.
Not just meno peke yake. We do both, actually, medicine and dentistry. Only thing is that we branch out on the last final years to go especially into the mouth. And you now major into that area.
And then the 1 year is a mandatory internship.
Yes, so 1 year now is mandatory internship.
Which is posted by the ministry just like the others.
Yes,
the other doctors.
Yes.
After which you get licensure.
Yes.
Who licenses you?
Now, after the internship, which is undertaken by the Ministry of Health, you're posted different hospitals. You interact with the pharmacists and the medicine doctors, and you do what you're supposed to do for those 12 months. And the licensure comes from the only regulator, which is the Kenya Medical Practitioners and Dentists Council, KMPDC. So that's the person given the mandate to give you the license to now see patients and do what you are trained to do to the best standards of practice that they exist. Yes.
And that's the only place that should license you. Therefore, and we'll come into that later, therefore somebody who's operating as a quack many times have a license on their wall. We'll come into that. I'm just wondering, is dental care part of universal health coverage?
No.
It should be, though. Do you think it should be?
Actually, there is one by the WHO which says that there is no health without oral health. So all this talk about UHC and UHC without oral health care being prioritized, that means there is no UHC. There can never be anything about that because oral health is so integrated to some of these non-communicable diseases like cancer, diabetes, cardiovascular diseases, respiratory diseases, pregnancy issues, complications. There is all that integration. If we are excluding the mouth, then we're not attaining fully what you're promising on this other end. So we are yet to get there. So those conversations are still ongoing.
Okay.
Yes.
I want to come back into just because we are saying here that there are quacks in the industry. Yeah. If I went to Kimana Health Center, naumwa na meno, who am I going to find in that health center?
Kimana Health Center, you'll probably find a nurse. Yes.
Na naumwa na meno.
Yes, and then the nurse
What is that nurse going to do?
Probably prescribe or recommend you to take painkillers, the lower level type of painkillers, and then refer you to a place where now you're going to see the dentist.
Which is a level?
Now that is supposed to be from level 3 or let's say level 2, and then 3, 4, or 5 and 6, where you find the specialists there to practice.
So if the nurse at Kimana Health Center sends me to Loitoktok level 4, I should find a dentist at Loitoktok level 4.
Yes.
Will I?
Probably no.
So what will happen?
Now, you see, the distribution of dentists in the country is so skewed. We have dentists in most of the urban centers. And then since devolution, there used to be a very systematic way of providing dentists into the outskirts, the level 3s and the level 4s. But as devolution happened, we've had a very unfortunate situation whereby in the public hospitals, most of them, like you're saying, like talk now, they may not probably have a dentist because the county governments, very few of the level 4s have dentists. And if there is only one in that whole locality. So for all the children, all the adults in that region, they'll probably be attended by a very few number of dentists. And the workload is so intense. So there's that much need for services.
So what will happen to me when I go to that hospital?
You'll probably struggle, have no one to attend to you.
Wait.
And you will look.
But there are doctors there and clinical officers in that hospital.
Well, you see.
Nimekuja hospitali.
Kustaviwa.
Nimetoka Kimana, niko na hii barua. Naumwa meno.
Kama meno imeuma kabisa, you will probably be medicated by pain medications. And if you're having an abscess or a swelling, sometimes things can go so bad you're getting a swelling. So you can have the pus drained out by any of the clinicians and be medicated. And then referred to go and see a dentist because it's a specialized area of care. So a special person must see you, and this is either a dentist or a specialized surgeon to see you.
So nitatumwa Kajiado?
Yes. Now Kajiado you'll find dentists now.
Okay.
Yes.
What's the ratio?
What is the likelihood, Daktari, of somebody in Kimana going to Kimana Health Center? Ameambiwa ende Loitoktok. Atoke Loitoktok ambiwa sasa hii yako hii na ni meno.
Well, it may look like as easy just like meno. Actually, the tooth can take you down.
Of course, it's painful. Yes. Right? And now you're telling them, go all the way to Kajiado. That's why you're going to get a doctor who can attend you. Right? So what's the likely scenario that's going to play out here?
Now, you'll be forced to look for circumstances to go look for care outside. Now, when you're going out there, you probably again not find dentists. You'll find other persons who are going to masquerade. They're going to offer you chances that I'll fix your issues. I'll either pull out your tooth or drain out the pus and do something to just alleviate your pain and discomfort. Now that creates a market need where persons see that this area is so profitable. Patients are in so much need. And if I set up a shop and I put up a placard, I'm a doctor, daktari wa meno, natoa meno shilingi 100. Patients will come there. And they'll come in numbers and you'll forever be in business. And because probably there's no one to inspect you or chase you out of work, you are in constant business.
And there'll be success stories.
Yes,
People will be referring each other.
Yes. Now that is happening everywhere now. And that's why you see so many mushrooming stations of kiosks saying, daktari wa meno, braces here, whitening. Most of those places do not have dentists.
Right. And I want to get into that, but before that, what's the ratio of dentists to the population of Kenya right now?
Well,
and what's versus the recommended?
Well, the recommended ratio by the WHO is about 1 dentist per 7,000 persons.
Okay.
1 dentist per 7,000 persons. Okay. We are close to now 55 million Kenyans with a very high prevalence of oral health care diseases. And actually oral health has the highest prevalence in the world on the non-communicable forms of diseases. So it's an area that requires a lot of attention and prioritization. And now with that ratio, since 1970, when we started training dentists in Kenya, we have about at most 2,000 dentists in the country. It's like the best job to ever want to be in Kenya. We're very few. 2,000.
Since the beginning. Have we accounted for those who've passed on?
Well, that's like the whole number since for those persons who passed on. So we are that many, I would say. And the ratio now at this point would be about 1 dentist per about 40,000 Kenyans. So most places as you go, most of the counties even don't have a single dentist. So a whole county government with its public health infrastructure not having dentists on board.
But the
or
dentists
probably having one dentist in the whole county.
Yeah. Dentists are there, but why aren't they, the uptake?
They are there. But the prioritization of persons organizing healthcare delivery, it's like they have not thought about it. That they need to hire dentists, fill up all their level 3s and level 4s with dentists to provide care. Now, it is unfortunate since devolution and since 2015 that dentists have not been absorbed in public sector. So they remain mostly in private practice. So to attract them to the public sector, that needs to happen. And that requires prioritized, intentional advertisements to call them to come and work. That is yet to happen in some of these places. So Turkana, Mandera, Wajir, handful of persons to provide care to very many persons.
Right.
So
And
that's
very
the unfortunate part.
geographically spread places. I want to get into the Quack conversation, but before that, you spoke about oral health in relation to physical health.
Yes.
A lot of people don't draw that nexus. Maybe just give us an insight into how oral health affects everything else.
Well,
Yeah.
now let's take the case about cancers. So cancers in the mouth, there are things that we do as habits. We take smoking, we do alcohol, and sometimes some of these things associate themselves with diseases in the mouth. And if you have been using some of these substances, you start having that ulceration. That small ulceration takes a few weeks, like 3-4 weeks without healing. And then eventually it progresses to something that is now bigger in your mouth, like the tongue is affected, the throat is affected, and you have a cancer. Now that cancer mutates and goes to other body parts and affects the body. We have things like diabetes. Diabetes is moderated by what is happening in the mouth. So if you have poor oral health, like gum disease, the sugars in your mouth, the bacteria in your mouth that are digesting those sugars, make your blood diabetes level sugars keep on fluctuating, and your diabetes does not get well controlled or well managed. You have respiratory conditions like pneumonia, which have a direct relation with oral healthcare diseases. So pregnant persons, again, with poor oral health, it has been found by science that if you're having a bad oral hygiene, gum diseases, this pregnancy that you're carrying, you're likely to have a low birth weight child because of that. And the outcomes of a low birth weight child has outcomes of development in years to come. So many things are so related, and no one is talking about some of these issues. High blood pressure, again, there is that correlation about all these things. So oral health care is central to how all these diseases are getting controlled of.
Just before, again, going into the Quack, Lyoto, who works with us here, has said, I've gone to a dentist once in my whole entire existence, and it was this year. Was I supposed to read this out, Lyoto? Group. Not that I've never had tooth issues, molars, on my own, rather than go to a dentist. Even when I got dental cover, I just couldn't go. The fear that surrounds dental hygiene, inafanya watu wanapambana tu na toothache, huku nje hadi meno inaacha kuuma. I think this is actually common. There isn't, Lyoto, what he's saying is possibly something you've heard a lot. Why is there so many myths, misconceptions, and fears around dentistry beyond the fact that there's quacks? What is it?
Well, fear is a complex problem in most places about access to dental care services. Now, fear is all about you've seen videos somewhere, someone told you it was so traumatic. Now, the trauma could be because you went to someone who did not know how to do the procedure, and they really struggled with you, tried to remove the tooth, and sometimes they fractured it, made it bleed. And that experience, depending on how you share it out to other persons, you affect how they're going to access care. And that creates fear all over the place. So again, when you keep with fear, you remain challenged with your problems, you let them accumulate, and by the time you're going to the real dentist, then you have so many issues listed on your care plan, and again, you cannot afford to see most of those things managed. So the fear keeps on to make the problem become bigger and bigger. But dentists do not need to be feared. We are trained to offer gentle care all over the place. So the dentist should not cause you pain. The dentist who's well trained should be very humane in providing care that is supposed to make you comfortable and live there without pain. Be it a child. We start seeing children as low as 2-year-olds, and they're supposed to be comfortable in the care work that is being done. So if you're having a traumatic experience, probably it was one episode, maybe driven by issues around what you had, or probably you went to see a person who was not well trained to manage your expectations. And if you're not a doctor, well, all doctors are trained to be humane and caring. Then this other person is just ready for the money. If you don't want to go, open your mouth, do this, or shoot out. So that's the gentleness that should be there during care delivery.
Now, let's go into the quacks. Because like you said, there's a mushrooming industry for dental care in the country, and then especially now cosmetic procedures, or I don't know if they're considered cosmetic procedures. So what's the proliferation? Yes, of quacks. Of quackery around the country, and just for not just cosmetic procedures, but for the entire dentistry. I know someone is asking here, who takes care of those in counties where there's no dentists? Who provides oral? And I think that's where the quacks come in. So let's start maybe from now a healthcare perspective, and then from the cosmetic side, which is still healthcare, but you get it.
There's a very great need. You see, the mouth expresses your happiness.
Yes.
It expresses your joy in life, and most persons want to look good and all that. That brings the cosmetic industry quite alive. So everyone wants white teeth, well-aligned teeth, and that aspect is so alluring that most persons, when you advertise on, see now you have social media.
Yes.
TikTok has so many video clips about healthcare in different areas, and most of these persons sharing those videos, those TikTok things, Instagram, X, those persons, most of them are not doctors, but they put themselves out there as doctors because they want to attract business to their outlets. Places like Isili, almost every corner point, there is a placard. Braces at 5,000 shillings, braces at 2,000 shillings. Most of those persons are not trained orthodontists. An orthodontist is a trained person who goes to school after the first degree, and they've gone to do master's programs on that particular field. They're the only one who's licensed after 8 to 10 years to provide that service.
What?
But you go to Isili.
Kuvalisha braces?
Yes, just braces. It's not an easy science. It's a complex science that allows you to give you competence to align that person's teeth. Now you go to Isili, get your wire work done, and it's banded for 3,000 shillings. You are happy because someone just said, give me the money, I'll give you braces. And it's all over TikTok. You do like a proper poll. Social media has all these adverts and noise and whitening and so many things going on. So you need to be on the lookout of who's providing care to you. I cannot say I'm an obstetrician providing deliveries because I can do it. Yes, but I can't do it because that's not my profession. So anyone carrying out or doing that trade that they're not trained in, it's proper quackery.
But how many
orthodontists do we have?
How many orthodontists do we have?
Yeah.
We have quite a few. We don't have that many. And that creates a need, a very great need, that everyone wants to look good. No one wants to look bad. So if I tell you you will look good at 3,000 shillings, at 5,000 shillings, you'll give me your money. And they know you need of it. So it's business for them. And they pick up fake licenses. Some of them have licenses rented out, and some of them are just bold enough to operate without no license because you will pay. And they'll call you out from TikTok to come as many as you are, and we will do the work.
But how do I verify? We're going into a break shortly. My naked eye can't know whether this is a quack from or not. So whether it's a list that should be published, because maybe there are also
websites that I can just
a website, and possibly a lot of them are not being flagged. And at some point, we need to talk about how perhaps the political climate is impacting healthcare, because I feel like there's a link when things go unchecked because deprioritization is happening. Then you'll continue to see it thrive because who then is checking them? But I can see it's coming up to 8:30. So maybe it's to come back and talk to us about what do we need to look out for? How do we know? And send us your questions. I can see a few people on YouTube exhaling about their experiences. You can call in and ask your questions. But yeah, it's coming up to 8:30. We'll be right back. Fixing Nation, one conversation at a time.
Amazing.
Yeah,
like
Daft Punk. I know we have a caller, so I don't know that we take the caller before we get back to the conversation. Her name is Janet, namesake. Janet from Kericho, good morning. I hope you're well. Do you have a question or comment this morning? A question also for Daktari?
Okay. Yeah, thank you. Thank you so much, Nation Crew. And thank you, Daktari, for coming and educating us on the importance of oral health. Yeah, the government is not taking it seriously about oral health because I was once having I'm having a crooked teeth and some yellow stains. I asked my neighbor who is a CEO, clinical officer, then I told him, refer me to a dentist. I want to do the cleaning and braces. Then my neighbor told me, Janet, I can't refer you to anyone because you will have bad consequences afterwards. Then I told him, they are all doctors. He told me, no, some of them, I don't think they are qualified. So I didn't do the process, I didn't do the clinic. So if the government are serious, even they can do the public awareness of even brushing the teeth alone to show the public how to brush the teeth. You brush in the morning, lunch, evening, or even twice in a day. Recently, we had, I appreciate Colgate. They had awareness in primary, I think, primary schools. Then my baby was telling me, Mom, brush your teeth in cycle. We were told by Daktari. Even simple things, government cannot do it. So what are the strategies? What are the strategies Daktari of even coming to Mashinane, telling people, because we are suffering in Mashinane. I mean, that's Mashinane. So we are suffering in Mashinane, how to brush even teeth. So later, for dentists, we take painkillers, we come home, but that one, it goes to a very bigger problem.
Yeah. Yep. Thank you, Janet.
Yeah, thank you.
Thank you. Yeah, public awareness.
Yes, it's very important.
Thank you, Janet. I think there was another caller coming in, but maybe you can speak to that, just even from a public awareness perspective.
Thank you, thank you. Well, the Ministry of Health in the State Department of Public Health, it is tasked with the duty of making sure that Kenyans know what kind of health conditions are existing out there, and particularly now oral health diseases. And through those promotive activities, they talk about healthcare prevention, oral healthcare prevention. They teach patients or the public about how to clean and take care of their teeth. You've had school programs whereby we have doctors and clinical community health practitioners going out there to educate the public about how to take good care of the health. Because with that, you reduce the burden of disease. Like I said earlier, we have about 46% Kenyans being affected by dental decay, gum disease, and many, many different kinds of oral conditions. These conditions can be avoided by prevention. And maybe the government or the public health has not been very strong on the ground, and you have the private players like the person selling toothpaste, like Colgate, Pepsodent, going to the field. And because they want to move their product, they will impart it with a bit of health education, and which is good. Again, we also have the practitioners themselves, the dentists, doing outreaches, camps, to go to the underserved populations and tell them this is how to take good care of your teeth or your mouth, and whenever need arises, this is where to go for care, and this is the referral channel for you to get served. So those things are happening. Maybe we just need to intensify them more so that all persons get a reduced burden of disease.
There's a question that Janet had asked you before the break. How do I tell? You know,
how do you tell?
If I just go to a health facility, nipate ule mtu wako hapo amevaa just cut your white, as far as I know, this is a daktari. Okay? You'll come and tell me later there's a clinical officer, not a medical officer. Those are details. So how do I start telling that this one is a clinical officer, this one is just a public health officer, and this one is a dentist? How do I know?
Well, each doctor, each person in the hospital has to have a tag that says who they are. You cannot just operate in a hospital or in any facility without identifying yourself. You have your name, Dr. So-and-so, dentist. Dr. So-and-so, pharmacist. Dr. So-and-so, medical officer. Dr. So-and-so, obstetrician. Dr. So-and-so, orthopedic surgeon or facial surgeon. A nurse as well. So each person must be identified so that you don't get misled on who's serving you. Now, for you to know who's the real doctor now, you'll probably go to the dental department or dental unit. It will be written on the wall. This is the dental department at Loitokto Hospital. And you'll see this is the unit, this is the doctor, this is the nurse, this is the assistant, that's a community oral health officer. And then you'll be seen firstly by the nurse, they set you down, then you're taken by the assistant, and then the community oral health officer will probably screen you and tell you this is a dentist to see you. So in that small environment, there are like 4 persons to see you. All of them will be dressed in white, but not all of them are doctors. So all of them have different work outputs and things to be done. So one of them cannot say, I will do the job from start to finish, because that's not their training, that's not their competency. And in that field, quality is assured now. Everyone has a role to play. Just like you have a pharmacist, not providing everything because there are pharmacists who want to sell drugs to you. So now to check again who you are supposed to be, we have the websites of the persons registering doctors in Kenya. On the website, you'll search the person's name, probably find a picture and their name, and they say Dr. So-and-so, a doctor registered with this address, with this license number, located at this particular place. That way you're able to find who is a real dentist, who is a real medical officer, who is a pharmacist, and who are the other support staff. In the healthcare environment, we have support staff. Our support staff are the clinical officers, community health officers, the nursing people, the technicians, the lab persons. All these people live in that environment. And they all work to give you that holistic feeling of satisfaction as a patient. So each one has a duty.
What website is that?
Now the website is kmpdc.go.ke. Kenya Medical Practitioners and Dentists Council. They will list all licensed facilities. Facilities. They will also list all local trained doctors, both dentists and medical officers. But unfortunately, probably the site is not very clear as to who is the dentist. You can search dentist. It probably will not populate to you the dentist. But it will tell you these are the persons registered in total as doctors, because dentists and medical officers are doctors in Kenya. So they will be listed there. There will be assistants as well.
If I search Kahura Mundia, what will I get?
Now, if you search my name on the website, you will find myself listed as a dentist first degree and a specialized doctor of the face. That's a maxillofacial surgeon. So you'll find that listed there with my licensure and retention for the current year. Now, some persons will not renew their licenses. They're out of line for not being in order on what they're supposed to do. If you're not finding myself there, then I'm masquerading.
How often do you update that?
Now, you're supposed to do the license every year. It expires, it starts in January, it expires 31st January. It's a way of you to be appraised that you're well fitting to be in the profession, to practice. So if you're not taking out your license, you're not a doctor. If you're not in the register, just collecting fees from unsuspecting Kenyans. And that is stealing. That is not okay.
What are the dangers of some of these quacks operating? Because we've talked about the way they operate, but then we don't think about
the dangers.
Yes, the dangers when they give you the braces or the procedure or whatever it is.
Now, the dangers are so many that let's start to begin by the basics of drugs. Someone selling to you drugs anyhow, without even having been trained on which drugs to give. They misuse drugs. Now, they can cause what is known as antibiotic resistance. Not everything is cured by amoxicillin.
Augmentin, because
it's readily available, and from my back of knowledge, I was given that the other time. I put on a white coat, I'll sell it to you. You prescribe. And the pharmacists, as many as they are, there are many chemists all over the place. Some of them, again, without pharmacists selling medication. So they're out in trade to just sell medications. Now, from the drug side, you go now to the clinical work. The clinical work person, he's not trained in the procedure. He will probably break your tooth. If it doesn't break your tooth, break your jaw in removing the tooth. If it doesn't break the jaw, probably perforate with the instrument somewhere else, or dislodge whatever he's trying to remove upwards into your nose, or into your neck, or into your throat, and that goes on. And the point they want to do is just get the thing out, get the tooth out. Anyone can remove a tooth. Anyone can. Even yourself, just give you the instrument, you pull something.
Has done two.
Yes. So, but you need to be trained in it so that you know what is the safest way to do it and what happens in case of an emergency. Now, out of that, again, you have other complications that happen thereafter. If something has happened and I keep quiet about it, masquerading as a clinician, I let you get infected by the processes. Then you realize later, why am I getting this swelling later? And you come to realize that it's because a tooth went into your nose and you were told it was out, but it is up in your nose. And then you come back 3 months later with a puffy face, and now the real doctor has to come in and intervene. Go to theater, drain out the pus, and have it well managed. If it's a fractured jaw, you have to go to theater, buy reconstruction plates and do orthopedic work on the jaw to fix it stably in the way it's supposed to be. If it's persons placing braces in your mouth and they're qualified, they'll make all your teeth shake. Now, your teeth are stable, but because you want to move teeth and have them straight, you don't know the formula and the science of how to do that. You adjust everything shakes. And now all your teeth are wobbly. You can't eat. It's discomfort. And then they start moving now and falling out. Then you have to see the real doctor. You have to be managed. Now, if it is an issue of cancer, someone does not manage it well. They think everything that is swollen in the mouth is something to just cut. Cut at 500 shillings. You cut a cancer, it spreads elsewhere, it grows bigger, it becomes something badder. And then now your outcomes start coming low. So the quality of health is not well addressed because it has been mismanaged at an early stage. If it's a condition that doesn't require anything to be cut out, you go in and cut out. You destroy structures that were there. If it's children, you start traumatizing them too early by removing teeth before their time has come. And then this child now starts having teeth that are aligned, crooked, because someone intervened and did funny things. And those persons out there cutting the back tongue, because culturally they think that tongue is making the child cough. Or those baby teeth that are coming out are making the child diarrhea. Not realizing that this child is probably crawling on the floor, putting hands in their mouth when they're young at infancy, and they start diarrheaing. But you go to this funny person and tell you, this is the problem. And they start using hot things or things just to poop out teeth, cause infection to the child, traumatize the child. And some children have actually died out of these issues. And because they were not seen by the real person.
Yeah.
But the information is out there. If you're not qualified, just refer. No point to say, I am the real person. I'll collect your money and I finish.
But if I'm unchecked, I'll do it. And I think there's a question I'd asked earlier, and I don't know whether this is something you're seeing. Political instability, it's a big thing to say, but protests, shift infighting, budget cuts, it just paints a picture of there's relative instability in the country and leadership. Doesn't this also affect and impact regulation in healthcare? I think I can see that happen. So these people will thrive, because who's checking me if there's so much deprioritization? And things happening. Is that something you're witnessing?
Yes. Yeah. We have had, or we keep hearing reports that the regulator has no capacity. No capacity to regulate and no capacity to visit everywhere in the whole country. And they are based in Nairobi with a few staff established, with a little small staff establishment. And because of that, they say we are handicapped. And now if you are handicapped, then anything goes. So prioritization of regulation to ensure standards are well met, that ought to be done. You cannot have Kenyans being attended to by anybody anyhow. It's not right. Again, on the issues of prioritization, our social health insurance, the other day as we launched it in 2024, is also not keen on ensuring that Kenyans have their healthcare assured as a benefit on that package. Right now, as we're speaking, we have zero dental benefits listed on the SHA packages. Zero. They still tell us we're going to discuss about it. Now, anyone who's probably going to see a dentist, they'll pay out of pocket because it's not covered in the SHA program. I think, and that's very disastrous, knowing that we need to even provide a basic care for children because they're really much affected, and maybe a care for the small basic dental care issues that require coverage. But you're paying regularly towards it.
I think there's a part of it that comes from thinking of dental issues as purely cosmetic for some reason. But there's a caller called Scholastica who wants to ask a question just before we get into that. Scholastica, good morning.
Good morning.
What's your question or comment for Daktari?
I have a question for Daktari. Good morning.
Good morning.
Go ahead.
Switch off your radio, Scholastica, or TV.
Okay, so I have a question for Daktari. My question is about the kids who are very young and they have started developing their teeth. Hello?
Yes, we can hear you.
So, you find that most of the mothers, they have a challenge when when their kids start diarrheaing and vomiting, then wanasema ni meno. So what they do, according to our culture, most of the mothers wanapelekea mama mzee, anaenda na gwara hizo meno, ama wengine wanazingoa kama zilikuwa zimedevelop mapema. Then unapata mtoto akienda kwa hospitali, unapata mostly ako na sepsis nyingi, and most of the time watoto wanakufa, ama unapata wanatumia antibiotics zenye ziko very strong ndio waweze kupona. So daktari anafaa atuelezee what are we supposed to do to this, maybe the milk teeth wanafaa kungoa ama anafaa afanye nini? Ama hii diarrhea yenye inakuja na meno, what are the mothers supposed to do? Because it's a very big challenge to mothers.
Thank you, Scholastica. Thank you.
Okay, well, for that particular one, Scholastica, you do not remove any child's teeth. Don't remove any tooth. Whatever is happening is a natural process. The teeth are coming out at the rightful time, that is 6 months, all the way to the time the child is 36 months. So don't do anything with the baby teeth. Let them be. Whatever is happening to the baby is something separate from the teeth, and it is because the child is having their immunity or their well-being getting strengthened. You see, by the time the child is breastfeeding from 0 months to about 9 months, their immunity keeps on to go down. And they're affected by so many cold things. They have common colds, they have diarrhea, they have stomach upsets. And again, at that time is when they're crawling. It's a phase of development whereby the child is having everything going to their mouth. So they're putting fingers, they crawl, probably your surfaces are not well cleaned. And that thing, those many things that they put in their mouth, they get bacteria, they get viruses in their mouth, and they start having a bad stomach. And a bad stomach, the stomach wants to clean itself, it will collect everything and shoot it out. And that is now the diarrhea. But now you associate it that the teeth are showing up at 6 months. And the teeth, and the child is also diarrheaing at 6 months. And because it's a practice, a cultural practice like we said earlier, you feel like this thing is because of this tooth. And then someone is out there in the village to tell you, yes, that is true. Which is not true because that is not science. Then now you go in now and start saying, we can treat this by removing these teeth and then the child will be well. You remove the teeth, it doesn't stop. You traumatize the child, they have wounds in the mouth, they cannot eat, they cannot breastfeed, they get malnutrition, and they will still crawl, and they still diarrhea more. And you'll have more issues, and the child goes to the hospital, dehydrated, in pain, they cannot feed, they are now over-medicated by medications, and things become bad sometimes.
You even talked of sepsis.
Yes, it happens because the persons even giving the formula of the drugs, they're not trained the drugs, probably at the low levels. So it becomes a complicated case by the time it's being referred for proper care. So the public in our communities and our villages need to be well educated. And we do this as dentists, at the antenatal clinics, at the mother and child hospitals, hospital units, to tell the expectant persons, this is what is expected of your care. So there are places where this culture is very thriving, like Lower Eastern Province, like the Somalis. They're doing this because they associate it with the child's well-being. If you don't do it, it's like FGM. If you don't do it, then your child is probably going to have issues and they'll struggle more. Do these things. You must cut the tongue, the uvula at the back, and you must remove these canines. So these are the baby canines, and they're all gorged out. So things that are avoidable. So, but we are doing the wrong things when we need to just be well educated. And probably it's a challenge to us to keep doing the same every day to make the public well informed.
We have so many callers and so many questions, but Catherine from Kahawa is on the line. Catherine, what's your question for Daktari? Catherine? Hello? Catherine?
Hello. Yes, I can hear you. How are you?
Fine, thank you. What's your question for Daktari?
How affordable is dental health for a common mwananchi? Because I have a friend who spent over 100,000 just having their teeth aligned and whitened. And to the particular doctor in the studio, being the president of the Dental Association, how available is he to these mwananchi who cannot afford the 100,000? Like, how affordable is it, which motivates this mwananchi wa kawaida kuenda kutafuta hiyo service now that it's not covered by SHA?
It's a good question.
Thank you. Well, dental issues, the basic ones, the general dentistry is not that expensive. It's very affordable. The cavities that require to be cleaned out and filled, it's quite very affordable. But the situation at present, you have to pay out of pocket. That little money that you've got, you must pay, because there is no insurance that probably will give you affordable or a bigger coverage, and SHA is not providing for the same. Now, cosmetic work, world over, cosmetic work is whitening, straightening of the teeth so that you look good. These are things that are somehow not really like emergencies. And because of that, there is a cost to it. And it is expensive. Now, if you want something good and well done, it is what it is expensive. Now, sometimes there are situations whereby patients want SHA to pay for teeth alignment. SHA will not pay. You want Jubilee to pay for teeth alignment. Jubilee will not pay because they take those things as exclusions. Cosmetic procedures that are very expensive.
Is it cosmetic, Dr. You're the expert.
Yes. Now, there are aspects of teeth alignment that are cosmetic. For most of the population, they are cosmetic. For a few, maybe a small number of population, it's not that cosmetic because there's a need to it. And the need now has to be qualified by a doctor's report, which says that if your teeth are this crooked, you'll not be able to brush well, food will hide in those crooked points, and then you start having decay there. So to prevent, you need to make them in a straight line so that you can brush smoothly, and then they become with less decay. So on an aspect of prevention, it needs to be qualified, but it's a case-by-case basis.
Okay.
Yes.
I'm sure there's a lot more questions.
Right. There was a question on Invisalign being available in public hospitals because they're very expensive in private. I think you've already kind of answered that. So that would be considered a cosmetic procedure.
Invisalign is pure cosmetic. It's top-range dentistry. It's like you want the best. Yes?
What's Invisalign?
Now, Invisalign is an American standard where someone in America came up and patented a system of aligning the teeth by creating small frameworks in the mouth that you put and they guide your teeth in a straight line. To make it's like it's a substitute to braces, and it's premium work. Now you cannot you can't give it to all Kenyans. This one is for those ones who have it and they are willing to pay it out of pocket, because no insurance oftentimes will pay for that. You pay out of your own want for it. It's like an iPhone or a Range Rover.
Right.
You want it because it's a good of that opulence.
Someone is saying, my teeth have serious issues, God is with us. And he's like, and I feel like that's a lot of people's approach to dentistry.
Yeah.
Then there's a question, Jonte, sorry?
Oh, Leah from Butere. I think we can take that in the next hour because it's coming up to 9. Is it possible, or do we just take her now? Because it's time for the break.
And then we go to the break.
Okay, let's take her and then go to the break. That's a good suggestion. Leah from Butere, good morning. Do you have a question for Daktari this morning?
Yes, I do. Hi.
Hi. Go ahead.
Okay, now I have a 3-week niece, and it's lively that I'm with her. I'm currently at home. So she's been crying for the last couple of days. And there are people who've come and they're looking at her gum and they're saying that she's developing plastic teeth. For some reason, I'm not able to see it. But then, when you're with the ladies in the village, for some reason, they're able to see it. And all these herbs that they're recommending, and they're rubbing it on her gums. And also insisted on cleaning her mouth. You know, the way the baby is suckling, and so her tongue becomes white, and so it's also being considered a concern. And I think it's not sitting well with me, honestly. So I really don't know, how do we handle such things? Because I've realized it's a common thing in the village setup.
Thank you.
Got a question?
Yeah.
Let's take a break then.
Yeah.
Then you can respond to that thereafter.
A 3-week-old, I think she said. 3-week-old.
Plastic teeth.
Yeah.
She said that she's developing plastic
Yeah.
teeth.
This was,
Yeah, she said 3.
3 weeks, yeah.
That's what people are advising her.
And they're rubbing different things, and
Yes.
there's the white on the. Let me tell you, babies and teeth. Let's come back and just
Unpack.
Yeah, it's a lot.
And what age do you start brushing?
Yeah, there's all of that. I think you can call us in the next hour. I think it's important to get those answers. We'll be back. Dr. Kahura Mundia, President, Kenya Dental Association. It's coming up to 9 a.m. We'll come back and answer some of your questions right here on Fixing the Nation.
Go there. Our conversation continues with Dr. Kahura Mundia, who is the president of the Kenya Dental Association. And we are today just learning about dentistry and learning how to avoid going to Quacks for various services. Just do not go to somebody to get a service at because amekwambia kuja takuosha meno. Before we took the break, there was a caller, and the question was on cleaning of teeth.
The teething. It was Leah from Butere, I think. It sounded like she was saying that baby is having maybe some discomfort or this teething, and then she's been advised to apply certain things. She doesn't know what to do. There's also the white, I think it's called thrush, that comes on the tongue as a result of breastfeeding or formula. And I know a lot of the time there's concern around cleaning that. I know that there's little thimbles that you can use. But again, if you don't have access to this information, so for Leah, what can you say to her?
Now, for Leah, I want to give her reassurance that whatever is happening to her child is... it's good that she's concerned about it. And actually, we need to start cleaning our baby's teeth or their baby's mouth quite early so that they get to understand why that is happening. Now, the white on the tongue, it's not a disease. It is just a coating. A coating based on what the child has been eating or feeding on, which is milk. And it's white because of that most of the time. Thrush is a disease. So in this case, it's black. And it's scrapable off the tongue with a piece of cotton wool in water, or a piece of gauze or a cloth and clean out the gum and the tongue. And it will just return to its pink or red as it was before. As regards the teething issues, the discomfort the child is going through, this normally will not happen that early at week 3. Most of the time it will happen now from the 5th month, when the child is supposed to have the first 2 teeth by the 6th month. So there are some medications that are used out there to provide comfort and to minimize the discomfort that the child is itching in the mouth. So sometimes there are those things that are sold in the supermarkets that are called teething agents. You give the child to bite to provide some soothing effect. You can give them carrots also, you can give them apples, you can just give them something to try and nibble on to soothe the child. So the discomfort has that temporary period of 6 months to 9 months as the teeth are growing up. But as the child learns to grow, they learn how to emotionally express themselves and they're able to withstand the discomfort. So it's a journey of development that happens. And again, for some of these things, there's a doctor who's trained in babies, a dentist. They're known as pediatric dentists. So there are different categories of specialization in dentistry. And these persons are trained to deal with children matters. Anyone who's below 18, from 0 to 18. These are specialized doctors to just attend to mothers and their children regarding their oral well-being. And the other specialized doctors for the same. There's even a doctor who's trained to just deal with the gum issues. A master's program. There's a doctor who's trained, like I said earlier, braces work. They do masters on that. There's a doctor who's trained in just cosmetic work. They're known as cosmetic dentists. The doctors who are trained in cavities, fillings. They're called restorative dentists. The doctor who's just trained in root canal treatments. And there are very few in the country. So their work is to just perform badly decayed tooth, restore them by doing root canal treatments. So persons who are doing root canal treatments, again, it's some area that requires to be done. But we have general dentists also trained to do the same, so that they're competent in that. We also have now surgeons of the face or of the mouth who are supposed to deal with badly decayed teeth or teeth that have failed to come out or cancer issues or trauma issues that are happening in the mouth. So all these persons are out there to provide care to Kenya as they should be. And some of these things cannot be done by the persons. I cannot probably do gum work because there's a gum doctor. So each person has a specialized area to deal with, just like we have it in the medical officers. You cannot have someone doing things that they're not trained in. But generally, they have a basic understanding.
They all have training.
A basic understanding to provide care on the ground.
Okay.
Do you have another caller?
Yes. Henry, if I'm not wrong. Henry, good morning.
Morning, madam. How are you?
Very well. How are you?
Yeah, I'm good. Thank you for media group, and thank you for Daktari.
Go ahead. What's your question?
Yeah, my question is, actually we have quacks in the system or in Kenya. I'm getting worried as how I can know exactly who is the true doctor and who is a quack. When I'm going to the hospital, I'm having a problem about tooth, which is paining me so much. And that process, I feel like I need help from a true doctor who can remove or who can help me relieve that pain. Now the problem, I'm worried. Like now, I have a problem of my teeth, which is broken from the side of my sharp, and it's paining me somehow. But I haven't gone to the doctor because I'm worried. Why? One of my relative or my neighbor went to to be removed, which maybe he found a quack. After he was removed, the tooth,
it was removed
wrongly, and now it made it have a full of pus in the canal, and then he was lost to the TC channel level 6, where it existed or it persisted a lot of pain, and he was referred to Eldoret Moi, where he was declared dead. Now the problem, I ask, how can I know a true quack and a quack and a true doctor? For instance, for this, I heard the doctor explaining there's a way you can identify the doctor who is on a list, but I didn't know the number on how I can identify that. Please assist.
Thank you.
Brian Polisana. That's really traumatic. Maybe, the doc will go, and I'll add a layer because not everybody will be able to log on to the KMPDC website and check that, Dr. Kahura Mundia is a dentist and a maxillofacial surgeon. Yeah.
Well, it's unfortunate what has happened to a colleague. This happens quite often in many places. Things are happening, and by the time you're coming to see the real doctor, you're getting referred, things have become so bad. And if it's not well managed, the antibiotics stop working because you've used all of them, they become resistant on you, and the disease now starts leaving the mouth, goes to your neck. And sometimes the skin that we have on your neck and our chest starts to peel off because it's a bacterial infection that starts from the mouth. It eats into the spaces of the body and makes the skin break down. It's called fasciitis. So that's when now the surgeons come in and intervene. So sometimes when it's so bad, you try to control what is happening in the mouth, but it has spread now, it's causing sepsis and it's now infective skin conditions. And the treatment is to remove all the dead skin because the disease eats and kills the skin as it spreads, so that you even now start seeing the muscles of the neck. So that's how probably a colleague had his neighbor succumb to this. It's an unfortunate situation because of lack of access in a timely fashion, or probably an availability of person on the field. So for him to be able to know who's a real doctor, he may not probably have data to check on the internet. There's a short code, about 2557. I think it's 2557. You're supposed to key in the person's name. Well, that's the real code. But when you search on the internet, you'll see the code to check who's a real doctor. It has probably not been well publicized so that Kenyans can see what is happening out there. Kenyans need to know where the doctor is at. Our regulator has a big duty to list facilities, to list dentists, to list medical officers, to list pharmacists, so that everyone who's checking gets to know where the services are. And that way you can verify with a picture, with a phone, or even before you pay someone, verify. Even call the Kenya Dental Association and check, do we have this person listed as a dentist? If that's not the case, then who's the dentist? And if I need to be seen on an emergency case, who can probably give me some alleviation of pain and then refer me to the real person? Because referral always works. But when you beat the referral chains, then we have chaos.
So we can say that if we use the public health system, then you'd be able to identify, or the system will be able to bring out the dentists, right?
Yes.
So if I went to a public health facility and I go to for public health facility, then I'm referred, I'll go to a facility where I'll find a dentist, right?
Yes.
Is that so?
What I'm saying is, in the public sector, even the private sector, if you are probably going, let's say, to Loitoktok, you're referred, you're seen by the nurse, they manage your discomfort, they tell you, go to Kajiado. You'll find a dentist there. Then the Kajiado dentist will do their work. And if, again, it's too complex for them to handle at that stage, they'll refer out to the next referral center. And sometimes you find Kajiado sending to Kenyatta, or maybe to Kenyatta University Hospital, for the now where the level 6 work is being done. So a simple dental issue can complicate all that up all the way the chain. That's why we don't just say it's a cavity. And when we see the government prioritizing only diseases of death, and disease of death, I mean it's renal issues and heart issues. Even this other disease is a real disease, and it can still take you down as those other diseases of death.
Yeah.
And it's more prevalent. So you're trying to manage the bigger diseases. Well, these small ones, they're piling up, causing more issues when patients are taking more medications. Those painkillers that a patient uses for a whole year to manage tooth pain will cause kidney disease. Then you'll pay 1 million to treat that patient's kidney issue. But you did not want to prevent the dental issue, which was avoided for a whole year, and the patient took a full year of diclofenac that affected the kidney.
It's all related.
The patient now is having kidney diseases, which now you're willing to pay for, but you refuse to pay for the dental pain that made them take painkillers for a whole year.
It's related. It's all related. Sakina,
go ahead. The code down.
Found the code.
Yes. 2547.
2547.
2547.
It's star 2547 hash.
It's a SMS code.
SMS code.
Yeah. So I'm actually looking at a tweet from KMPDC. We are thrilled to see the overwhelming response to the toll-free SMS short code. That's 2547. So this was earlier in the year, and that's in 2023 actually, and they had received about 15,200 requests that have been processed. So to verify the status of a practitioner, you send an SMS to 20547 with the following name, P hashtag full name of the practitioner, and then P hashtag full name of the practitioner. So then that should be able to give you the status of their license, whether they're licensed or not, what
That's
they're licensed
good.
for, all of that. So that's quite good. And
20547.
I can also do the same for health facilities with H hashtag and then the full name of the facility.
Okay.
So H hashtag Kenyatta National Hospital.
P
like
was
that.
for dental.
Practitioner.
Yeah, practitioner.
Practitioner, then H is health.
Yes.
Okay.
Yes.
So 20547.
Yeah. So in this case, it would be like P hashtag Kahura.
Mundia.
Mundia.
Okay.
Yeah.
I've
Then you
said
get-
that. One with a space, Kahura, space Mundia. Another one without a space, Kahura. I'm waiting.
to see what comes back. Sakina, Latif, just a few questions we're taking in. When I took my year-old, because she just says years old, when my year-old nephew to a family dentist, she insisted that he required braces. So that can't be, I don't know, one. And some front teeth to be extracted so that they align well. But then when I consulted with my dentist, he refused. Why? Sakina, maybe you can just verify the age. And it looks like, you get different opinions. She's also said, is it okay to have children eat at least 2 cloves per day for teeth because of the natural oil?
Well, on the clove feeding, well, that can happen because it's known that clove oil has a benefit to good oral hygiene. As regarding the other matter of teeth alignment, now persons who are out to just sell anything to you, they will sell anything because all they want is your money. So even if probably you don't need braces, they will push you towards it and create a situation whereby you feel so desperate that you must have it done. So there's a qualification as to why braces must be done. And it must be done at a particular age group. And again, on a case-by-case basis. So most of the time you not have less than 10-year-olds having braces. But you can have interventions that are done to prevent more misalignment of the teeth.
Right.
And the persons who are trained in this are the dentists who know how to do these jobs. And when the cases become dire from ages 13, they refer now to the real trained person to make the teeth alignment. But if I want to take your 5,000 shillings, I'll tell you, they need them. But some people are just, you see, it looks like an easy science. You take the filling material, stick it on each tooth, put a wire, give me your 5,000 shillings, go home. You don't even do recalls or follow-up. You're just fixing things in people's mouth and collecting money. So it's like a boat point, a toll station, and there's a queue because I've hooked up persons on TikTok. They're sitting on the bench.
Yeah.
And it's just an issue of wire work bonding. So even the person selling these items, these are controlled products not to be sold to anybody who's not trained in them. The persons hosting these clinics, the landlords, they're hosting illegal clinics. They should be found liable for hosting a quack in their premises for not doing the real job. And then the police need to be out there to regulate and check what is happening.
Right.
So the
You've
main things
answered
to happen there.
Sakina's question because she says the son is 7 years old. So that definitely doesn't fall under
Doesn't qualify.
It
yeah.
may not qualify
It may
for
not
braces work because
Yeah.
it just requires a review and a reassurance. You can do preventive work to avoid even the braces themselves. So there are things that
Yeah.
all require about information.
The
need to add up.
toothpaste question, I think somebody had asked. I know that there are certain toothpastes for children until a certain age, at least from experience.
From what age?
Now,
From what age do they graduate?
Toothpaste, we've had issues, because we have KEBS and we have PPB. That's the Kenya Bureau of Standards and the Pharmacy and Poisons Board to regulate which product should be in the market. Then there's UK standard and then the US standard. We have an issue in Kenya about fluoride.
Yes.
Fluoride is good, fluoride is bad.
Yeah.
Yeah.
Excess fluoride is bad.
Yeah.
And it causes all these things that you're seeing about teeth discoloration. And because it's so, we're in a Rift Valley region and most of our rocks are volcanic and have a lot of fluoride content, the boreholes that are dug everywhere. With all these apartments having bad water, I'll call it bad water because it has a very high level of fluoride. Fluoride will not give you a bad taste in the mouth. So you will not know. So you consume bad quality water, you have discolored teeth, then the need is created and someone says we'll whiten your teeth. Then tell you what the villages will clean teeth at 100 shillings each tooth. So they count the front of them, 600, and they say they're using herbal medications. Herbal medications, they're using hydrochloric acid, sulfuric acid, because it's known to bleach.
Okay.
And then you mix with a few herbs, take a stick, call yourself a herbalist, and put a border and say, tunasafisha meno hapa, daktari mitishamba, whatever. Those
They're
are
actually
quackery
using
shops.
acid.
It's acid because it will bleach. And that is discolored. But you mix with a few herbs and you say it's potent and it can work. We have a cure and you have a few testimonials on TV and it's business and it's booming.
Yeah. And
you say, Daktari mitishamba wa kusafisha meno. That's quackery of a different form towards the herbalist side. They say they're not doctors, and then someone issues them a license to become herbalists. And herbalist scope is not regulated in Kenya. It's freestyle, it's business. Now, back to our issue of now the
toothpaste.
The toothpaste. The fluoride level, it's not well known. It is known in science that it should be less than 7 parts per million for baby toothpaste from years 3. But years 3 and below, it's 0 fluoride. Because at that time, you don't want to expose the child to more fluoride. You want them to be free of fluoride. And then from 3-year-olds and above, you now start introducing the 0.7 parts per million. Then for the adults, the recommended toothpaste level fluoride is 1 part to 1.5 million parts per 1.5 parts per million volume of that toothpaste. So there is an addition. In some countries, they add fluoride to minimize tooth decay. In our sector, we have fluoride in potatoes, fluoride in our tea, fluoride in the food, everywhere.
We're good on fluoride.
So we are almost good on fluoride, but you still need some level of fluoride for preventive and protective aspects. But when it's too much, it's toxic. Not just the teeth, even the skeleton. The way your teeth will look brown is how your skeleton, your skull will look brown like that. Because it's so gone into your body, it's bad and it's toxic. So Nakuru County, they have that major issue. Water levels, the water quality is by the county governments to clean out the water systems and have persons access clean and safe water. In Nairobi, we're lucky that the other dam here is selling good water, but the apartments on these other sides of Nairobi, the certificates of occupation, they are approved. The public officers, they say the apartment is safe, come in and rent. But I'm happy to hear that some persons in Langata sued their landlords for bad water selling to them. So you as a resident in that estate, you need to be sure about what type of water you're using. It will look clean, but the quality and the chemical formula of that water will affect you many years down the stream, even your children, and you even wonder what's up. And then just earning up bills when it's all preventative by the county governments and yourself as residents in that region.
Let's take Levi from Zimmerman. Levi from Zimmerman, good morning. Do you have a question for Daktari?
Good morning, Fritza.
Good morning.
Good morning.
My name is Levis from Zimmerman.
Yes.
I wanted to inquire about something. Back in the year 2012, I had like an accident. Nikaanguka kwa floor and nikiwa shule sasa. One of my incisors ikatoka together with the root. So since then up to now nimekuwa na hiyo gap. I've never replaced. So I was inquiring from the doctor, how well can I go about it without evading the quacks in the market? The only like after they may replace, it will be a route to other problems. Yeah, that's my question. But you're doing good work. Thank you.
Asante sana.
Thank you.
Well, for Levi, it is true that we have teeth loss happening everywhere. And it can happen from falls. And now we have this good activity that we do on the roads, our border riders. It's unfortunate that they follow their own rules. And they fall and they have no helmets. They break jaws, they lose teeth, and many things happen to them. And they have to be seen by someone. So for Levi, for the missing tooth, we have treatment which is to replace your tooth. And there are different ways of replacing the teeth. And again, the person who is supposed to replace the teeth are dentists. And they're trained to assess you and guide you on the choices. You have like 4 choices available to you. And they tell you this is the cheapest, this is the second best, this is the most expensive. And there are things that we can even do to you if you're an adult, and there are things that we cannot do for you when you're a child, when your child has fallen and they've lost their teeth. So you probably not intervene. In some stages, some areas you'll intervene. So based on the choice of the doctor will take a model, send it to someone in the lab, who they work with the dentist. They're known as lab technicians. Lab technicians are not doctors, but they're out there acting as doctors. And circumventing or shortcutting the process, they tell you, we'll open a kiosk. I'm a lab technician, I put on a white coat, I say dentist. They are trained to fabricate in the lab. They're not trained in the human aspect of seeing the patients. To integrate that, so you need the dentist to give you the clinical aspect and the lab person. They to communicate and give you something. They can give you a temporary replacement that is removable. Or they can give you a permanent replacement that is fixed on the area. So depending on how much cover you've got or availability of cash, you'll be able to be given the real choice. And you can transit from the temporary to the permanent as per your needs, deserve, or guide.
Okay.
Yes.
We have to get into what recourse exists for all the people who aren't going out there meeting quacks and unfortunately, suffering all these terrible outcomes. Legal recourse, yeah. Let's begin.
We have a legal recourse,
yeah.
Only that we've never seen it being enforced by anyone. Maybe it is high time we saw this happening by the regulator. The aspect of saying they have no capacity, it's disastrous, it's saddening that we have problems in the society, and they are aware and they have the full mandates to it, and it's yet to happen. So the law provides that anyone masquerading as a doctor, you're just saying I'm a doctor, clinician doing this, I'm supposed to be penalized by paying a fine of up to 5 million and serving a jail term of up to 10 years. And if I'm running a facility, claiming to be registered and licensed, I'm supposed to also pay 5 million fines and a year term of about even 10 years. Again, persons who are employing quacks. We also have now these many hospitals in the country and many facilities because anyone thinks there's money and business in the healthcare space. And we have about 9,000 facilities or even more than that. Everyone wants to call you, come here, we're doing something for you. Then they employ the persons who are not well qualified.
Right.
They tell them, you will be served here. Because all they want is your revenue or your income.
Yeah.
So those persons are also not supposed to do that as per the law. That is Section 23 of the Kenya Medical Practitioners and Dentists Act that provides for that kind of regulation. So recourse is by complaining to the Kenya Dental Association, complaining to the police, complaining to the Medical Practitioner and Dentist Council. The same persons who are supposed to enforce the law. You complain to them. You can send an email, you can call, you can send it out to the CEO or to the legal officer departments. Right. Then they have a committee that sits to check out these complaints. But again, we probably have not seen that happening so that we get to be aware about it and then avoid some of these events.
Does the KMPDC act on these complaints? Because prosecution may take time, but the KMPDC is in a position to act very quickly, and not just the complaints of quacks, but even cases of, for example, sexual assault by dentists, and doctors when people are under anesthesia and things like that, because we've heard of cases like that. Yeah.
Well, yes, they're supposed to act. The KMPDC has an internal tribunal. It's like a small court inside there, whereby you report the complaint as a patient, and they have a committee that calls an expert in that field, and then they validate whether you're a real person providing this job. So they've had challenges like I've had, like the herbalists. The herbalist will say we cannot fall under your jurisdiction because I'm registered in the herbalist section. So like, who is that in the herbalist side now? So that's a different type of work. Now, the real quack, if you're not a real doctor, it's a closed and shut case. You're not licensed, you're not supposed to do it, close it and finish. Police case. Criminal matters, prosecute that way. If it's a dentist who now has done malpractice, now there are dentists who can also do some funny things. We have such cases. If they happen, you also report them to the regulator. They are vetted by their own peers, and if there's a case to answer, they are penalized and they pay damages towards alleviating that discomfort they cause the patient. So it happens, but maybe the whole assortment of all those events is not publicized. We need to have a way where we can reform our tribunal to make it known that they're actually doing something about the quality care that is happening out there. Yes.
So, but it does happen.
They have teeth, yes.
Do licenses
sure that.
get revoked? Do licenses get revoked?
Well, we have not had any licenses revoked for dentists, but you cannot revoke a license for a quack. They're a quack.
I'm not talking about a quack, I'm talking about now malpractice cases. Yeah.
We have, I was looking at the website today in the morning. We have one registered doctor, medical doctor. I think it's a case that happened one time in Mwingi, whereby a doctor left a patient in theatre and they said, I will not do it. The patient, whatever happened to them. So that's the only case we've had registered in the country. We have like 2 suspensions of medical officers. That's, you can look at the stats on the dashboard of the KMPDC. But for dentists, this has not happened. Because dentists are trained to be diligent and to do their work in a way that is ordered and humane. But for the other persons, they live in another realm where
all over the place.
Anything goes.
I want to talk about that structure because sometimes I feel like some of these things are structural issues. The Kenya Medical Practitioners and Dentists Council licenses doctors and dentists.
Yes.
Does it?
And the community oral health officers.
And community oral health officers only.
Only. Then we have other bodies for other people.
Then they also license all health facilities.
Yes.
Okay. Now, if you look at the way health is provided in the country, there are public health facilities, faith-based health facilities, and private health facilities. What's the percentage of those?
Well,
which one is more?
We are about 50 public, 50% of the population of the facilities is 50 for the public sector. And it's the one that's most well distributed in most of the places.
Yeah.
That's where it's like the main place for you to access care will be a public facility because it's affordable. You'll probably be very sure that you're going to find doctors there. The only thing is that the doctors are not employed. We keep striking about doctors' employment, joblessness of doctors. It is happening because...
So understaffed
facilities, public facilities.
Okay.
That poses another crisis. But it's intentional by design, which you could argue politically, to understaff, to sabotage the public sector, which is supposed to be stable, so you can create traffic for
private.
Yes.
So
to have the two systems thriving. So 50-50.
Faith-based and private.
Faith-based and pure private-owned. You have more private-owned than faith-based.
Okay.
So that is the situation.
Okay.
But they claim to have more bed spaces than the public sector to manage medical conditions that are happening. That's why you're seeing the other day, the CS of health saying about bed sharing and all that. So the balance needs to be there. We need the two sectors, but we need order, good order in that sector.
Just to be clear, when you say private here, we are not talking about these big facilities that are, for example, in the urban areas. Even the small facilities still in the urban areas, in the slums and all, those are private.
Yes, you see,
Right.
anything private is personally owned or a group owned, and then it can now be church-based, either Muslim or Indian or Christian owned, missionary owned, SDA owned, because they also see they have a role as a religious grouping to provide care to the people and community. So those groupings show up.
And then there are those two things that, you know, they just mushroom. Are they all licensed?
No.
So you'll find like a hospital here, it's written XXX hospital.
Now, unfortunately, before 2019, we did not have this chaos. But the chaos was because they wanted someone politically wanted to open up the sector. And you'll just pay the 15,000 shillings for your license application. And to put up a small facility, small kiosk, you'll pay 15,000 shillings or 20,000 for the year. And you just need a room and a bed and a desk. You'll probably a clinician, either the clinical officer side or the medical officer side, and they put up something. And eventually, if it's a real thing, it grows to become a bigger facility with a real name, like the way we have Roy Family Hospital on the other side in Roy. Then you have those others who just try out. They pick up a name or rent out someone's license. The persons who are selling out their licenses, which is again not a good thing. And they just get revenue and rent on their licenses. Well, this mischief is happening and more persons are getting harmed out there. So the regulation, the inspectors were supposed to go out there and check on these things is where the chaos is at.
They need to do that. Can I ask, there's a question Kikombe here has asked. What African traditional dental practices would you say were abandoned, but you feel they would be beneficial to dental care? For example, applying cow dung to teeth, eating sugarcane, etc.
Well, we may not have a proper series of those traditional practices. There's the chewing of
stick to say of the stick,
by the mostly Somalis, the Masais. There's chewing of some herbs. There's chewing of some resins from some trees. They help to stimulate flow of saliva in your mouth. Saliva is a good thing because it cleanses everything that has been there. And in the old days, those persons were probably not used to processed food. Cakes, biscuits, sugars, sodas, they were not there. So their diets were pure, clean meat, and you're good, and you probably not have this decay that is happening as it is rampant right now. So cultural shifts in how we have been socialized in the urban times, that causes. Cow dung, well, it's a little bit tricky, but I've had persons doing salt, traditional salt by crushing rocks and chewing charcoal. So the frictional aspect of the charcoal helps to control whatever is happening. And charcoal has an antibacterial effect to make bacteria slow down on the effects. And somehow you have some good oral health hygiene. So some persons who do coconut oil, they crush the coconut, they chew, because it's also been known to try and elevate. The same thing you're talking about, eugenol, and some fruits and sugarcane. Sugarcane now stimulates the frictional aspect of you chewing the extract, and it helps cleanse out the mouth. So that's how it works.
Let me go back to that question. I was threading it somewhere. So the regulation of these facilities, there are gaps there in terms of inspection. Okay. Then you said earlier that we have 2,000 dentists who are trained in this country from time immemorial up to now. Some of them have left us. Others have decided to go to farming and to into real estate or to leave the country and go work elsewhere. So how many members do you have currently at Kenya Dental Association?
At the Kenya Dental Association right now, we have close to, you see, it's a professional body.
Yeah.
We are expected to be having about 1,800 members on board with us, with about 200 having left the country. And out of those ones, we are supposed to be members by subscription, which is they pay some little retainer to be retained, to be trained. We have a requirement that every year we must retrain and get points to renew our licenses. That's the way you keep polished up as a doctor.
Yeah.
So we have about now close to going towards 600. We're having some more coming in because we want them to be part of the family that keeps dentistry alive in the country. We have two universities, unfortunately. That is Nairobi University and Moi University, that trains dentists in the country. And this probably has contributed to the low numbers. And just 2 months ago, we had Moi University. The dental hospital side, the only one striking because they have no supplies for the facilities to see their patients. And for that, they cannot treat, they cannot sit the exams, they cannot finish school. And that's why you find persons sitting at the Moi University taking up to 10 years before finishing school. Because if these departments are not supported at the universities, work does not flow. So the infrastructure is outdated. The input or the persons who are supposed to go in there, it's limited because you don't have many units to train doctors. So in Kenya, like I insist, there are only 2 universities training dentists. Any other is masquerading.
So no private,
and it is masquerading
no private
outright.
universities train.
There is no private university. There are some claiming on the website because they want to missell and attract. That is mischief by a business person who's claiming they're training dentists without the proper standard of accreditation being met and being licensed to train dentists in the country. But we encourage many more to come, follow the channel of regulation, get licensed, and to meet this need of shortage of dentists in the country.
As it stands, the University of Nairobi and Moi University, Eldoret. The caller is on the line. Jonte, what's their name?
My name is Evelyn.
All right. Evelyn, what's your question for Daktari?
My question to the doctor is about the gum disease on my lower teeth. Whom can I see or what can I do?
Okay. Well, gum disease, it's brought about by probably not having regular cleaning up of the teeth. So whatever we eat, over time, it accumulates. As much as you brush, you cannot say you've brushed 100%. So something remains. So the accumulation of whatever remains, it's hidden somewhere between the teeth, between the gums, and it starts causing gum disease. So it starts as a small bleeding, a small swelling, it goes down the bone, the tooth start to shake, and then you have a big pocket of pus that is now causing rampant disease. So gum disease, how it's supposed to be managed is regular brushing. If you're probably brushing once a day, go to 2 times or 3 times a day and use a mouthwash or mix something at home with salty water, rinse out your mouth. And when it's so bad, see a dentist. Now what the dentist will do after the assessment is to clean your teeth. There's a service that is known as cleaning of the teeth. They use a special machine that goes between the teeth, below the gum, and cleans out all this accumulated debris. And now you have a clean mouth, and all the bacteria, if it was 1,000, it goes down to almost 50. And you're in a better place, and you improve your oral hygiene. So, but if you don't do this regularly, when you don't see the dentist as you advised twice a year, issues accumulate. And if you're seeing the dentist for the first time when you're 50, 40, issues have accumulated. And the bill is quite expensive. So prevention is by going to the dentist early. Don't wait until you have pain. Because it will start as one cavity, go to 2 cavities, 3 cavities, a fracture, an abscess, an admission, and now crisis an ICU case when it started small. So it's just an accumulation. It's our behavior-seeking habit that we need to work on.
Emmanuel Templar says, may God Almighty bless our dentists. I've been to Tenwek Mission Hospital. People from all over South Rift and Kisii start queuing at 6 a.m. for an appointment because of the quality of their work. So that's, of course, a massive hongera to the dentist and to the medical practitioners at Tenwek Mission Hospital. But it does speak to sometimes the inconsistencies in levels of care that we see. Examples of, for example, like this one person you go to says braces or do this, and they could all be registered, right? The next person says no, or this needs an extraction. Someone says this needs just consistent care and realignment, and we can.
So how do you know what action to take?
Well, you see, the training of dentistry world over, it's standard. If you go to a dentist in Tanzania, go to a dentist in Uganda, go to a dentist in the US and the UK. The curriculum is standard. It's an international degree, Bachelor of Dental Surgery. You're trained in one way of seeing things from the community level, preventive aspects, creative aspects, and follow-up after and referrals. So for anyone to deviate out of that, they're probably not trained in it, and they don't understand the science. And not understanding the science is because you've done a short course somewhere. If you do a 6-month thing, you're not a dentist. If you do a 3-month something, 6 months, you are not. You must do the full course and do it the 6-7 years to learn the full trade, and the challenge has come with it. So anyone saying they learned by observation. There is no science that can be learned by self-observation. Again, it's unfortunate, like what you said, we have Tenwek. It's fortunate thing, Tenwek is doing a good job. Some facilities are doing a good job. Kenyatta is doing a good job. KU is doing a good job, the new facility. And then we have Nairobi with the Lady Northi Hospital. It is the only children's hospital in the county government and in the country. A children's dental hospital. It's a pure hospital to just deal with children matters and dental issues.
So Nairobi County.
So Nairobi County, well, it's lucky they found it in the Nairobi County, not that they started it. It was there since the colonial times because it was for the whites who wanted to have a facility to see their kids and have their matters dental attended to. So it would be much prudent if you had dental hospitals or children specialized in different regions, either by public sector or private sector, or more prioritization of reinforcement of staffing and infrastructure at the public facilities. If each level 3, if each level 4, level 5 had a dentist department with a dentist and specialized doctors and support staff working, then we'll not have these issues that you're talking about. Patients are not even paying more because it's expensive in private sector than in public sector.
Gum issues seem to come up a lot. Maybe we can speak to what cause. You've talked about poor dental hygiene. How bad can it get? Can it get cancerous? How do you know when it's something simple that can be treated with pain, I don't know, antibiotic, and when it's getting really bad?
Well, that's true. Gum disease can mutate to many things. It has a relationship, like I said earlier, to pregnancy issues. It has a relationship with cardiovascular conditions, respiratory conditions, and even diabetes. Poor gum disease is a sign of bad diabetes management. If you have good gum disease, your diabetes, if you're having such a condition at the same time, it's much better because you have a clean mouth. So you're advised to regularly have your mouth cleaned out to manage these issues. Now, if it's not well attended to, that small gum thing that starts out there, 2 weeks later it's swollen, it's an ulcer, it's not healing. And the body has a way of just transforming itself. That you're not attending to it, it's cautioning you do something about me, and that region you're keeping to ignore it, it becomes non-healing. It starts to increase in size. As it increases in size, sometimes it can become cancerous, and then you need to now have specialized attended care. You have those habits that are supposed to be causing things. There are things that we do as some communities. You have the Indians who chew something that's known as the betel nut. There are persons who do kuber. There are persons who chew mogoka. There are persons who are chewing mira. Some of these things, they are mixed up with so many things, and they cause irritation in the mouth. So that constant irritation of the mouth causes ulceration. If you're a smoker, every time you're having that smoke, affecting the gum, affecting the tongue, you're taking that alcohol, you're mixing it all together, and then you have a very perfect environment for any ulceration to stop healing. And that association of factors causes issues downstream. And 10 years, 15 years later, you have an ulcer that now starts being cancer. And you have about cancer being listed like the 15th issue that is killing patients, and cancer of the mouth is difficult to treat. You have to take out your jaw, dissect your neck, sometimes do radiation to your chest and neck, and manage it in extensive forms. So these things are avoidable. And it's unfortunate, sad to say, I've met an 80-year-old from Meru. 8-year-old boy.
8-year-old boy.
From Meru.
Yeah.
Have you been exposed to chewing mira from the farm? Because they're harvesting together, or they're somehow just playing around and everyone is chewing. And unfortunately, because we want the crops to grow well, we spray pesticides on them. Now, these things are transported all over the place. If they're not well cleaned from the farms, you are leaking and consuming those pesticides and chemicals. So again, from that 80-year-old that was quite so shocking, I'm seeing an age group in the region that I practice in, a population of young men and women who are coming with oral issues. You finished high school at 16 or at 17, you've been chewing mira until you're 25. Now you have a cancer in your mouth. What happened? The tongue is stuck. The way you move a tongue freely, the tongue cannot move. It is fixed on the mouth. What's the history? Mogoka, sugarcane, or not sugarcane, the big G's, and the smoking and the bang and all that. Now you have an ulcer and the tongue is gone. If the tongue is gone, you only have like a few months to go and adios. So it's that bad. So prevention and probably having the pesticides control in the farms needs to be done to minimize these kind of conditions. So it's quite sad to the young populations.
There's a question by Diasa here. It says, I broke a tooth partially when young. It broke again when I was an adult. Can I remove the small piece that's remaining at the age of 50? I'm scared. Please advise.
Well, if there's a broken tooth that has been left for quite some time, sometimes it can get infected. If it's not infected, it could stay. But the best thing is to go for attention first, to be advised on what's the precaution to take. Leaving it there without you constantly cleaning it well, it can cause an issue. And because we are busy in life, we'll brush the teeth that we see. Whatever is hidden down there will not reach it. And eventually, bacteria accumulate around it, it starts causing you pain, and infection starts, and it needs to go. So don't keep broken teeth in the mouth.
All right.
Yes.
Last one, on a much lighter note. According to the NHS in the UK, you're not supposed to rinse when you brush, just spit.
Well, cleaning habits, they are different on how we advise. We advise regular cleaning of the mouth, morning and in the evening. And if you have to, and you're probably very busy, once a time in a month, and regular checkups. Now, rinsing the mouth, it depends. You're rinsing with water or rinsing with a mouthwash. So there are different conditions and advice that we'll give depending on each case. So there are persons who are very much exposed to decay and bad disease, gum disease. We'll tell them to rinse with a mouthwash and not rinse with water after. If you're a person who is probably having a clean mouth, we'll give you a different set of advice. So advices depend on how you're presenting. The person will tell them to brush regularly and come even every 3 months to the dentist. Others will tell them, I want to see you after 1 month. Others after maybe 6 months. So each case has special instructions to be given.
Bottom line.
Standard procedure.
Standard procedure, twice a year, dental visit, brush, and rinse.
And spit.
Rinse and spit because you've brushed. Because some people say, I don't want to feel the Colgate or the toothpaste feeling in the mouth. In some cases, we tell you use a mouthwash before or after. So it's not very well standard. But what is important is brush. The brush is most important because it removes whatever is stuck on your teeth. And the teeth remain with a clean surface.
All right.
Okay. Wow.
Yeah, Daktari.
It's a lot. This cannot be engaged in
1 hour or 2.
It requires 7 years of engagement.
But it's helped a lot of people.
Indeed, it has. Yeah. And the most important point here is avoid going to a quack.
Yeah.
And the direct way is go to a public health facility. They'll guide you towards a proper professional. Or what's the number?
Go
if you'd
2547.
Send a message to?
The SMS to that number.
547.
Yeah. The format is P# and then the name of that professional. Whether you'll find out whether they are or not. But yes, P#, your hash symbol, and then the name.
Yeah. And then you have the private practitioners.
Hashtag the facility.
The facility. Yes.
Thank you.
So you said something about private.
Yes, private practitioners. They are those ones who are known, established persons who are dentists in private practice. Either as an individual or a group or a bigger panel of doctors in dentistry who are providing these services. They're all out there. So, but verify so that you get to know you're being seen by the right persons.
Okay.
Thank you.
Karibu.
Dr. Kahura Mundia is the president of the Kenya Dental Association. Your world is coming up next now. And they'll have a band. It's Friday. Usually have, last week it was dancers. Today, it's a band. It's not us guys. When us guys come, it'll be...
Bandwidth are taking a break for the weekend. We'll come back bigger, better. Fear not.
That's on NTV. On Nation FM, we'll be with Claudia Naisabo, of course, and Brian Aseli on the Vibe Shift. So tune into that as well. Tupatane Monday. I'll see you.
Yes.
6 to 10 a.m.